Well, we can now move on, and we can give the floor to Dr. Lorenzo Bettoni. He's the head of the Department of Immunology, Rheumatology and Allergology in Manerbio, Brescia, and we'll talk about the role of antioxidants in rheumatic diseases. We know that rheumatic diseases affect over 10% of the population. They're social diseases. And he's going to talk about the correlation with cell oxidation and the underlying pathogenetic mechanism. Good morning, everyone. Thank you so much for joining us today, and I'd like to thank Giorgio Terzani for organizing all this. Paul Ehrlich, Nobel Prize winner in 1908, he noticed that some charcoal colors colored some tissues and microorganisms, but not all. This difference would have allowed a toxic dye to kill a tissue that absorbed it without damaging the tissue which didn't absorb it and rejects it. So we can eliminate the dangerous microorganism without damaging the host. We can see a classification of the Italian Association of Rheumatology. We need a magical bullet, and it's quite hard to identify what disease to target. We don't know what it is. It might be a Eurodream cell food. It might be Bologna's climate. I feel very good today, and I think I can make it. If we scrutinize the literature, we may have a chance to find something. As correctly stated by our chairman, we know that rheumatic diseases are social diseases affecting over 10% of people. So we can subdivide them into three groups: degenerative, inflammatory, and immune toxic. Degenerative group are osteoarthritis, joint structures are affected. It is primary or secondary. Pathogenesis, age is very important, overweight as well. We know that for a knee or a hip, it does make a difference if a person's 50 or 150 kilos and also muscle weakness. There's an inverse relationship between level of exercise and our osteoarthritis. The more the physical exercise, the more our joints get lubricated. This is a classical distribution: the spine, the hands, the knees, and the hip joint. This is our target, the chondrocyte, the center of cartilage homeostasis. The chondrocyte is attacked by different substances, including metalloproteinases and free radicals, which cause degradation, which tips the scale of cartilage towards osteoarthritis, and joint health is gradually lost. A vicious circle is triggered off, which leads from a normal joint. This is a knee. You can see the difference from with an osteoarthritis knee. Let's go back to the degradation. I found a review in the literature on orthopedic studies. Here we can see that the mitochondria that were discussed by the previous speaker, in these mitochondria the free radicals are active and cause a degradation process and leading to osteoarthritis. So eventually, free radicals play a crucial role in the development of osteoarthritis. February 2011, musculoskeletal disorders. Nitric oxide into the synoviocyte makes it lose energy and viability, and conclusions are the same. Nitric oxide leads to a loss of viability and energy of the synoviocyte. So we know we need to consider the disease-modifying drugs, i.e. the drugs that have an impact on the disease, that modify the disease, such as antioxidants, which play a role. Let me use this slide, which is quite funny. It is a degenerative disease. We know that free radicals cause aging, so I haven't discovered much new. Let me move on. Osteoporosis. Here we can immediately understand that there's a big difference between a normal bone and a bone affected by osteoporosis. In effect, there's a loss in bone mass and a loss in the trabecular bone, the architectural structure of the bone, which gives it flexibility. I'll skip the classifications and I'll come to this slide. We can see the evolution of a woman with osteoporosis. Let me apologize with the ladies here, but I have to give a present to all male participants. You will see the three ladies again. Here, the three ladies. You can clearly see that there's a considerable difference from before and after. And the after is that it's not that this stomach here is not related to weight gain, but to the alteration of the spine, which causes a abdominal protrusion. And there's a susceptibility to bone fractures in over 60% of patients. So there may be several fractures, a domino effect and a vicious circle leading to loss of independence and increased death risk. How can this be prevented? No smoking, no alcohol, that's all very well. So when you're standing at the bus stop, you need to place your leg in this way on up, like this lady, and we can prevent osteoporosis. Physical exercise, dancing, never age. This is an excellent way to prevent osteoporosis. I'll skip all this. Nobody's ever too young or too old to improve bone health. Support your bones. They support us. They support you. Calcium and vitamin D are very important, but we must always remember that small things can sometimes be very dangerous, such as the little drop that can gradually erode a rock. This is a recent publication about free radicals. They are very small things that can affect the bone structure and cause osteoporosis. If you're not convinced, there's another one, the Journal of Surgical Research, where plasma levels and femoral levels of free radicals are considered, and the conclusion is oxidative stress is involved in age-related bone loss. And a big smile here is more evident than in the previous picture. And then we have the inflammatory conditions, rheumatoid arthritis, Pierre-Auguste Renoir. If you look at the hands of this man, he had a rheumatoid arthritis, but in spite of his hands, he was able to paint Le Bagneuse a year before he died. He was really amazing, because imagine with these hands being able to paint or sign or even taking a walk in the park when your feet are in that condition, because this is no these are patients that we see in our clinics, in our outpatient clinics. Thanks to medical developments, we can treat the condition and reverse some of the damage thanks to biological drugs. Biological drugs get their name from genetic engineering. They are genetically engineered substances. They are very expensive. They have an effect on pro-inflammatory cytokines such as anti-TNF. And the treatment must be started early because erosion starts early in these patients. Here we can see a summary of the approach. The earlier, the better. This is what the treatment should be like. The earlier, the better. So what used to be the old therapeutic pyramid is upside down now. You need to be aggressive at the very beginning to stop the disease. Rheumatoid arthritis, it's an inflammatory disease. In the literature, this is the International Journal of Rheumatic Diseases in 2009. We can read that oxidative stress can cause degradation of connective tissue, which then lead to rheumatoid arthritis. And besides rheumatoid arthritis, there's another inflammatory disease, a connectivitis, which is systemic lupus erythematosus. Through the chemokines, they are wonderful substances. They recall the cells and get them out of the vessels and into the inflammatory site. This is the image, and now I need to laugh. If I laugh louder, because I've been able to target inflammatory diseases. The last ones, the immune toxic diseases, they are not very well known, and sometimes they are even not diagnosed. And we need to consider a eye disease. Scotoma is an area of blindness in the visual field, and around the scotoma vision is quite good. Scotomization is never taken into account. This is a scotoma. We can see everything except that black area, the center. So due to preconceived ideas, we may say, well, we don't really care what's hidden behind the black spot, because we know it's a track, it's a train, it's at a station, and maybe trains. So we don't care what's behind that. And this is a bit like the attitude with these diseases. Sometimes there's a hole behind that. So we'd rather not scotomize diseases, pretend we don't see them. These diseases affect 4% of the people. And in figures, November 30th, 2010, according to statistical data, 424,000 people in Italy, so it's quite a few, but we're still lagging behind in the Middle Ages. We pay no attention to that. But these people manage to live, to get by. They learn how to dance in the rain. Fibromyalgia is one of the 3 diseases characterized by diffuse persistent pain, long-lasting, day and night, refractory to any kind of treatment. There are some tender points to be used for diagnosis, and Wolf has developed new criteria on fibromyalgia that I will skip. Next year I will tell you more about it. There are symptoms associated with fibromyalgia, difficult concentration, urinary tract symptoms, etc., and chronic fatigue. It is not due to underlying or associated diseases over 6 months, disabling, associated with lymphadenopathies, headache, muscle pain, and bad sleep. And the last is the MCS, multiple chemical sensitivity. Patients respond to chemical stimuli in an abnormal way. It mainly affects women, it is a systemic disease, and affects the whole body. The triggering factors are chemical factors, particularly oil and its derivatives, drugs, printed paper, cigarettes. So these patients are poor metabolizers. They gradually clear or slowly clear the toxic substances that are ingested or inhaled, and these toxic substances gradually build up until they reach a limit. In today's world, we're full of toxic substances. Our world is characterized by these situations that you can see in these pictures. So clearly, we need to detoxify ourselves somehow. Do you think the world is only about pollution? It is not at all. We also have this world. Can you read this? Dad, can you get me a high-tech quadriband cell phone with USB, Bluetooth, hard disk, blah, blah, blah? You want to take drugs like everybody else, don't you? We're so... there are so many cell phones, Bluetooth, we are really soaked in waves, and that does create a damage. What is the common denominator of all this? It's oxidative stress, peroxynitrite, nitric oxide, and FDA. So at this point, there's no need to be good at strategy or military strategy. We understand that very clearly. What do we need? We need an antioxidant, very simple, as it may seem. But there is a word, diversity, a word that we can see everywhere. Diversity. I'll show you something and you will have to tell me what it is. What was that? What was it? It was a pack of... Tell me the brand, please. No, you see, that was not right. You can see you didn't see that right, so you can easily understand that not all similar things are totally equal. And in the constellation of antioxidants, even if they're all very similar to one another, we need and must choose the ones that for safety and reliability can give us something more, that little plus. So the ones that are spelled in the right way. I hope at this point I haven't put you to sleep, at least not all of you. I see some of you are still awake, and I'm glad to see that. So my idea was providing a more pleasant overview of rheumatic diseases, not in the same old way. At this point, you owe me a favor. You must not hide yourselves behind a blade of grass, nor wear a bathrobe. Be honest. The magic bullet has been found. Thank you.
Grazie, dottor Bettoni. Sicuramente abbiamo
Thank you, Dr. Bettoni. I'm sure we've understood the importance of detoxifying ourselves and also learning to dance in the rain. That must be very enjoyable.